Today I'm interviewing Steve Schensul, who is a longtime member of the Department of Public Health Sciences. He is now emeritus following a very prestigious career here, and we're going to have a conversation about his life and career. Good afternoon, Steve. Good to see you. We're going to have a conversation here about your life and career. I look forward to hearing more and maybe learning some things I don't know about you yet. Maybe we could start with where you grew up and where it all began.
Well, thanks a lot, Doug, for inviting me to do this interview. And just a note that since I became emeritus in 2019, you've welcomed me into the department and to continue in the department. And I appreciate the fact that you've encouraged me to do as much as I want. So,
well, we're glad to have you. We always want people to stay connected to us.
So I was born and raised in the Bronx, New York.
Ooh.
I went to what was a deteriorating school system in New York in the 1950s, and but managed to slide through, and also managed to end up in a magnet school, Stuyvesant High School, one of the leading schools in the country, at which I was one of the leading members of that school. I was struggling to kind of find myself. I went on to Hunter College of the City University of New York, and it's actually I had to travel about an hour to get to Stuyvesant, and I had to travel about 10 minutes to get to my my university, my college, and proceeded to continue a kind of lackluster performance until, strangely enough, what woke up my mind was macroeconomics. And why I did well in macroeconomics, I have no idea. But soon after that, I had one of the most wonderful teachers I've ever encountered, Dorothy Cure. And she had taught in a number of different graduate schools in the New York area. Had a botanist for a husband, traveled the world. And suddenly she opened up a new world to me, related to me very well, and as a result, I changed my life course, moved on beyond a relationship that was kind of in lockstep to get engaged and then married, managed to be accepted into the University of Minnesota in anthropology, and discovered medical anthropology at the University of Minnesota. And also another great member of my mentor for me was Perty Bert Pelto, who guided me, further turned down my brain, and I did quite well in graduate school.
So I'm sort of curious, what lesson do you draw from the fact that a couple of individuals that very easily you could never have met made such a difference and changed your life course?
Well, you know, the concept of apprenticeship and mentorship is still undervalued.
Yeah.
In many institutions, whether it's at the college level or the graduate school level. And I always thought that that was the key to going into a discipline.
Yeah.
That, you know, we can't imagine a plumber who hasn't gone through a training preparation and working with somebody they admire.
Yeah.
And similarly, I think in academic work, we need that mentorship. Not necessarily consistent with laboratory mentorship, which may mean that the individual is working under the immediate direction of more senior researcher, but that guidance and feedback, and it reminds me of my son, who came back with his English essay, and this teacher had written more critique than he had written the original draft. And
I think we've all had that experience once or twice.
And I think I said, that's fabulous.
Right.
That's fabulous. Somebody cared enough.
Yeah.
And that was, I remember Bert Pelto having a red felt tip pen. Mm. And everything I did was bleeding. Yeah. As a result. But that bleeding always left me with a clear direction of where to go.
Do you think a young person today can consciously seek out someone who makes that difference in their life? Or is it sounds a little bit with you like it was a little bit by chance?
I think they were both by chance, but it may have been a different period, because their competition for grants are really tough these days. There's more burden on individual faculty, and I think the area that suffered the most has been that mentorship area for students. Yeah. There may be, I don't really know the degree to which we've developed a mentorship relationship among senior and junior faculty, but it's vital for students to have that kind of relationship. If you go through graduate school in whatever field, and you don't have a personal relationship with somebody who's going to give you critical feedback, I think that's a major problem.
I think a lot of people, especially in their younger years, struggle with accepting critical feedback. I don't know, when you went to grad school and got writing back with red marks all over it, did it initially bother you, or were you really pleased to get that feedback?
You know, it's what the message is being conveyed. And so, for me, the message was, you're doing good work, it could be better.
Right.
And that was an uplifting, it wasn't a downer.
So your mentor had a skill at communicating criticism that was helpful.
Yeah.
Well, that's an important thing to learn.
So as part of being at the University of Minnesota in the Department of Anthropology, I began working in northern Minnesota. You were talking before we started about cold in Chicago. This was 49 or 50 degrees below zero in Bemidji. And
sorry for cringing, but yeah.
So I have to tell you a quick story about culture. I pull into a farmhouse, a long driveway, I get stuck in the snow. The woman who was the farmer came out and unstuck me, and I got into the house, and before I could start the survey instrument we were doing, she said, "Would you like some dinner?" I said, "Oh, no, thanks." And she said, "Okay." And part of what happened there was that in the Bronx, I would have to go through a ritual of no, thank you. And then they would ask again, and then they would ask again, and then but not in northern Minnesota. It took me 3 households to get smart enough to say, yes, I'd like dinner.
Right. That's a great story, Steve.
So the work in northern Minnesota, I was living in a town that was smaller than my apartment block in the Bronx.
Wow.
But I learned a lot about field work, and then the head of the department had generated field work money and said, no, you got to go somewhere else other than northern Minnesota. So I picked out Uganda, went there on my own, had an enormous amount of money that he had generated, so I got a Toyota Land Cruiser to drive around, and did my work in Uganda.
What year or years was this?
1968.
Wow.
And
that was a turbulent time all over the world.
Yeah, not so much in Uganda.
Okay.
Mobote was in, and there were some checkpoints, but nothing real serious. And that was a great experience of driving. I actually picked up the vehicle in Tanzania and drove it across 700 miles across alone.
Wow.
And the only reason I survived that is total ignorance.
Yeah.
Which is a wonderful protective device. So coming back from and doing my work as a comparison of the structural situation of northern Minnesotans and southwest Ugandans, the only time that'll ever be done in the history of mankind. I wanted to do, I didn't want to do research any longer that didn't immediately impact on the population I was working with.
Yeah.
And so at a time when sociology and anthropology had split and everybody was desperate for anthropology, I got about 12 offers sight unseen. I got the only offer I had, which was to be in an applied program, and that was a community mental health program on the west side of Chicago. And quickly learned that the clinicians weren't very impressed with what I was generating. But as an anthropologist, I could go out in the community and found another set of mentors, this time community activists, who were trying to build an understanding of the needs of a rapidly rising population of Mexican Americans, or Chicanos, in the west side of Chicago. And that, in many ways, I can relate to that neighborhood more than I can relate to my neighborhood in the Bronx at this point. That was a great experience, and it was like having a postdoc. But it was learning with failures, with some successes, with building an organization called El Centro, and building a clinic, and arguing for changes in curriculum at the medical school. And those 7 years really structured the rest of my career. A brief stay at the University of Miami, and then it's been almost 50 years at the University of Connecticut, where we...
And what brought you here 50 years ago, almost 50 years ago?
Strangely enough, Bert Pelto, my mentor, was here. He was the head of medical anthropology at in Stores, and brought me in, and my first job was to find citizen groups involved in health action. And that's where I met Maria Barrero, who ended up as the first director of the Hispanic Health Council in 1978. Maddie Bell, who I'm working with right now to do a memoir of how she and I came together, me from the Bronx, she from Oglethorpe, Georgia.
Wow.
To contribute to the Charter Oak Rice Heights Health Center, which became the Charter Oak Health Center, and a number of other community organizations, most of which were based on empirical research. And that was also a very exciting experience.
So what do you mean by organizations that are based on empirical research?
Well, in this particular case, and when you have a group that's not receiving its fair share of resources, in whatever realm, whether education or housing or other things, you have to make an empirical argument to the powers that be. And we had the ability through an NIH grant with the first grant received by the Hispanic Health Council. And the first grant that I knew about that was given outside of a university to identify the fact that women were reporting being sterilized without consent and without an understanding of the fact that it was not reversible in most cases. And so we did some careful research and follow-up to the survey and presented that both at the Hartford Courant and at the state legislature, creating a change in, because Hartford Hospital physicians were making decisions about women's fertility, that they felt there shouldn't be any further need to have more children past 2. And if the individual had 2 and was out of wedlock, as they called it then they felt the right, without working with women, to sterilize. But there were a number of issues like that. There were behavioral health issues. There were syndromes that were cultural, that were not understood by the authorities. There were various kinds of, for example, asthma, which was seen, you know a great deal about asthma, but in the Latino community, it was seen as a mental health problem. It was literally classified differently, and because of that, not. So that ability to convey those kinds of results called for a community health center at a remote area of Hartford where there was a public housing project, and it would take 45 minutes to get to to any closest hospital, and we were able to build an empirical base for that as well.
Well, that's and you were, and what was your role in all of that? So the grant was outside of UConn.
Well, this broke all the rules.
I see.
I was the PI.
Okay.
The grant was out of the health, outside of the university, and yet it was using university time.
I see.
But this was early days.
Yeah.
So nobody knew quite what, I'm not even sure I knew what I was doing.
Yeah.
But it was tremendously helpful. And from that data came a significant behavioral health program. We then got a grant for an urban AHEC, the first urban AHEC in the country. And that lasted about 3 years and also allowed development of neighborhood health teams, school health.
And AHEC is Area Health Education
Center.
Right?
Yeah. So that first decade and a half was really focused on Hartford and using skills and knowledge I had developed in Chicago, but also working with a great set of community activists here. And that led, in the process, we developed a program called the Center for International Community Health Studies. That was a Title VI program. And that led to research in Peru in 1982, in Sri Lanka and Kenya, and then finally a real focus on HIV and sexual risk in Mauritius, in Sri Lanka, and then for 20 years in India, with the same principle.
you came here to stores, but now you're...
No.
No, you came to this...
Yeah.
Okay, I'm sorry.
Yeah.
I got that wrong.
We had a very dynamic chair.
Okay.
Probably he provided even more flexibility than we really needed. But Jim Walker, who
I know the name.
Yeah, and I was quite close to him and left me with great flexibility to take advantage of opportunities. And I can't continue this story without saying that I happen to be married to a medical anthropologist who's an extraordinary researcher, highly productive, and built the Institute for Community Research over the last 40 years. That has contributed to my work as well as to hers. So it's been an exciting trip overall.
So what about teaching? What was your experience teaching students? I think you must have done a lot of that.
I did, but not in formal courses. I did my one course a year.
Yeah.
Which all my colleagues in stores hate me for that.
Right.
But the real time I invested was trying to give back to students in the form of what I had learned from Bert Pelto. Yeah. And so I spent a lot of time on, and somehow had students who were marginal. Not marginal in their intelligence, but marginally less, had less the, how do I phrase this, less the opportunities for writing or for presentation and I enjoyed that. Well, I didn't enjoy it all that much. It was hard work.
Yeah.
And I recognized how much work Bert Pelto put in with me and others when I started doing that work here. And recognizing, for example, that a PhD student is going to take 10 to 15% of your time in the year that did it, writing up their dissertation. And that if you don't recognize that,
yeah,
you're going to be burdened, or you let them slide. And to let them slide is horrible.
Right.
We're undermining our very commitment to education when we do that. And I've seen it, not only in our department, but in other departments.
Yeah.
And I kind of understand it by nature of how much they have to put in to succeed in their own. So there's not enough, perhaps, time and understanding when you take on a graduate student.
I think many of the students I've worked with and that I hear faculty talk about, both before I was here and since I came here, struggle with writing. Writing is very hard, as you know. I wonder if there's something you would say about learning to be a good writer.
Well, the key, and it's interesting because I've worked with a number of people in which English is not their first language, and that doesn't matter.
Right.
What matters,
I agree with
is
you
logic.
completely. Right.
If somebody who's a native English speaker doesn't write with a sense of how you lay out the argument,
yeah,
you're screwed.
You can always correct the grammar.
Right.
Yeah. But correcting the underlying logic and structuring it well, that's a much harder task. Yeah, long ago I realized that part of being good at writing is just doing a lot of it. And a lot more than people think, especially when they're younger and less experienced, that it takes, and you can't just do it for a little while and then be good forever. You have to keep at it. So we face a lot of problems in the world today, not some of them not as maybe as extreme or as gross as your example of sterilization, and I think our students are almost uniformly are concerned about the world and these problems and want to do something about it, what advice would you give them about how, in the current context, not the one that you started out in the current context, how to find a path toward making a difference and having a meaningful career in life as you have?
Well, that's your third difficult question.
I'll take credit for that.
The concept of linking your work at the master's and doctoral level with addressing problems in the real world is a difficult one.
Yeah.
And it's one that pushed at least me to not make that linkage until I was out of graduate school. But I don't like that model particularly. And I think that what we're looking for is students who can apprentice to individuals who are mounting that link in communities. And so you're not asking a student to take, we had a wonderful group of students in 1980. They just came in and they, in anthropology, they gathered for their first orientation, and we said, the hell with the orientation. We're doing a health fair in Charter Oak. Just come with us and get involved. And these are some of these are students who are retiring now after a wonderful career. So I would say that if a student is inclined to that linkage, they got to go find somebody to apprentice to. And once they get out and have their PhD, it may be more difficult to find the level of flexibility that I had, but it's a lot easier to not threaten your PhD or threaten your advanced degree by doing that work. I think that that it's also possible to learn a great deal from the people in the community, and as I did. And so that's another tier of almost setting up a kind of postdoctoral opportunity. Now, if you're going to, in this model, if you're going to be take a position in the university, sometimes I think of stores as a big black hole. People go out to stores and they fall into the hole, and it takes them years to climb out of it. And they never manage to get back here to Hartford, even though you've interviewed them on the way. You've got to have a strong commitment and a willingness to do at least 150% rather than 100% to get that job done of having a foot in the community and a foot in the university.
I wonder if you would agree with me that a fair degree of perseverance and tolerance of failure is important on that path as well.
Yeah, but I'd add another element of seeing an opportunity.
Right.
It just marches by, and unless you're willing to grab it and see it, somebody might say, well, that's completely irrelevant for me, and they could be right. But that ability to grab it and redefine it or aim it is a key element in that process. And that can be open to failure. But there really is what we do is somewhere in between success and failure. It never gets the success, and it never ends up as a complete failure.
Well, I think that might be a good point to end on. Steve, thank you for this conversation.
This has been great. Can we do this as therapy?
You'll get my bill.
Okay.